Yet another significant change in cancer screening guidelines affecting millions of women. As you know, there's been controversy all this week over when women should start having mammograms. Well, now, believe it or not, there's a new recommendation about testing for cervical cancer as well that's causing some confusion. Our Dr. Jennifer Ashton is here to fill us in. Good morning.
Good morning, Maggie. It's been an incredible week. Today, the American College of Obstetricians and Gynecologists, also known as ACOG, is releasing updated guidelines that recommend less frequent Pap smears to detect cervical cancer. Under the new guidelines, women should begin getting tested at age 21 instead of 3 years after becoming sexually active as previously recommended. Women in their 20s need a Pap test every 2 years rather than annually. And women 30 and older should wait 3 years in between tests once they've had 3 consecutive clear results.
Prior to the 1980s, there wasn't good science to dictate how often women should get Pap tests. Since then, we know more about the disease.
Cervical cancer, unlike breast cancer, is generally slow-growing and uncommon in younger women. Doctors say fewer screenings could lead to fewer procedures that could cause future fertility problems. But the new guidelines may not deter women from their routine.
I feel more comfortable just going back there, every year.
For years, other doctors have been preaching get a Pap smear every year. Now, we're going to tell women, well, you don't need to do it every year, and it's just going to cause a lot of confusion.
Now, the new guidelines might actually be more of a surprise to patients than to some gynecologists, since the changes have been evolving for over a decade. Cervical cancer rates have fallen by 50% in the last 30 years due to extensive Pap testing. But it is very important to remember that less frequent Pap smears do not mean less frequent gynecologic exams, Maggie.
Important point. Thank you, Jen Ashton.